This is Fox News Midday.
Welcome back. April is Testicular Cancer Awareness Month. And now just to put that into perspective, about 1 in every 250 men will develop this type of cancer. Here to explain more about the warning signs is Dr. Naveen Kella. Thank you very much for joining us. And kind of talk to us, Dr. Kella, about how does someone know that they possibly could have testicular cancer?
Thanks, Brianna. So testicular cancer, like you said, is very common in the men who are between the ages of 15 and 45. 1 out of 250 people, believe it or not, men will eventually have testicular cancer. But in that age range, the 15 to 45-year-old males, that's where we typically see presentation. And unfortunately, why we have Awareness Month is most men don't know. They don't ever check down there. And it's a disease that can easily be treated if it's caught early enough. Really, if you're thinking, well, what are the symptoms going to be? There's not really much you're going to notice except a lump on the testicle. Occasionally it might come with some infection, but usually just checking yourself is the way you're going to find out.
And how often should someone check themselves to make sure that this doesn't happen? Because 1 out of 250 people, that's a lot of people even here in just San Antonio.
Right. So checking yourself is something that we tell patients to do once a month. Doing it in the shower is usually the easiest way to do it. You just get comfortable with the anatomy down there, and it's a little bit of manipulation with the hand, and you can feel the testicle, and there's a part of it next to it called the epididymis, which you don't want to get confused by, but once you know what it's like normally, then once you check once a month, you can see if there's any changes.
Okay, let's say someone does have a scare and they go to the doctor. What are treatment options like if they are diagnosed?
So that's, with cancer, we're always worried that you're going to die. With testicular cancer, fortunately, the treatments have become so good that the chance of cure is almost 100%.
Wow.
And usually the surgery first is the first option. We need to remove the source, which is that testicle. Fortunately, the other testicle can usually do the job, so men can continue to have kids. If there's concern, we could bank the sperm. They'll continue to make testosterone. There's other treatments afterwards, such as radiation, chemotherapy, even immunotherapy, but surgery is usually the first thing we would do. Okay,
so the bottom line you're saying right now is to make sure that you check yourself, especially if you are in those ages of 15 to 45, and anyone can get it though, or any male can get it, and then also lead a healthy lifestyle, you recommend.
Right, 15 to 45, you should be checking yourself once a month. Leading a healthy lifestyle, we don't have definitive proof for testicular cancer, but it makes a whole lot of sense because it helps with so many other medical problems.
So many things, yes. Workout, healthy dieting, everything like that. Well, thank you very much, Dr. Kella, for joining us.
You're welcome. Thank you.
And if you'd like to get more information, you can head over to foxsanantonio.com. Ernie.